So in this study, basically we wanted to see, so this is a phase 2 trial, single arm study, single center study. This was where we gave Rucaparib 600 milligram twice daily to the patients who were non-metastatic prostate cancer, biopsy-proven adenocarcinoma. The second eligibility criteria of these patients, they need to have HRR mutations, thereby meaning homologous recombinant mutations, as I mentioned, BRCA1, BRCA2, ATM, RAD51, these mutations. And the third thing was, it was through the conventional imaging, we confirmed that these patients were non-metastatic. So a CAT scan and a bone scan was done to confirm that they were non-metastatic. After this, we enrolled the patients. So in total, we had 7 patients which were recruited. The median age of these patients were 69 years. The median Gleason score was 7. And these patients had, out of 7, there were 3 patients who had BRCA1 or 2 mutation. 2 patients had ATM. 1 patient had RAD51, and another patient had BRIP1 mutation. So when we recruited the patient, the overall duration of the treatment which patients were was close to 18 months, and the primary endpoint of the study was PSA progression-free survival. The secondary endpoints of this study was PSA 50% reduction, safety of the drug in this subset, and the third one was knowing if we can reach to the PSA undetectable level. These were the secondary endpoints. So when we studied, we found that the overall patients, the overall PSA progression-free survival was 37.64 months in these 7 patients. And out of that, in the secondary endpoint, we found that 2 out of 7 patients had also achieved PSA 50% or less. And those 2 patients, when we followed, we also found that the PSA became undetectable. First patient had a BRCA2 mutation, and the other had like RAD51. So in short, these 2 patients had a really good response. Coming to the other secondary endpoint, which was safety in our patient data set, was no patients had any dose-limiting toxicity or any severe adverse events. 2 patients had grade 3 adverse events. One was anemia and the other was rash. So overall, I would say that in our study, we found that Rucaparib was found to be effective in certain biomarker positive patients like BRCA2 and especially RAD51. Unfortunately, the study was prematurely closed when the PSMA was considered a standard of care for the patients of non-metastatic hormone sensitive with high risk biomarker positivity. So that was in brief about my study.